guys, I'm gonna go through the bones of the body for you. So remember that we can break down the skeleton into the axial skeleton and the appendicular skeleton. So I'm gonna start with the axial skeleton. So the axial skeleton basically forms that longitudinal axis of the body. Okay, this is going to be what is highlighted in green here. And it's divided into three parts. So you have your skull, you have the vertebral column, and then you have this bony thorax area. So this is the view from the back. Okay, so the skull. I'll go through a lot of the different bones and things like that that you need to know. You will need to know some of the bones of the skull, but keep in mind that you will be given a word bank with the ones that you actually need to know. So you don't need to know every single thing, but you do need to know most of them. So the skull, there are two sets of bones. You have cranium and you have the facial bones. But bones are going to be joined by sutures, and we're going to talk about joints a little bit later, but essentially sutures are these really kind of firm joints that really don't allow hardly any movement. The mandible is actually attached with a freely movable joint though. That's really important for eating and talking and such. So here's a side view of the skull. So just to hit a couple of highlights here, you have your frontal bone, okay, along the forehead, the parietal bone, okay, along the top back, the occipital bone, okay, temporal bone. Here's your sphenoid bone, the zygomatic. This is going to be, this purple area is going to be the maxilla. The nasal bone is right here. And then here is that mandible that's pretty freely movable. There's a couple of other different other areas on here. I'm really more concerned that you know the main bones. Okay, so if we look from the bottom, this is now kind of giving us a different view. Okay, here's the occipital. One thing I do want to point out is this is what we call the foramen magnum. This is where actually the spinal cord is going to enter or kind of connect to the brain. Okay, here's your temporal bones on the side. Here's that sphenoid bone that kind of travels down in here. You can see this is the maxilla, and you can see a little bit of the zygomatic bone. Okay, from a front view, similar things that we saw before. Again, here's our frontal bone, our nasal bone at the very top of the nose, our zygomatic, our maxilla, the mandible. Those are the big ones that I'd really like you to make sure that you are comfortable with. One interesting thing about the skull is that there actually are what we call paranasal sinuses. These are hollow portions of bones surrounding the nasal cavity. Really great for lightening the skull, but also really important for resonance and amplification of the voice. Okay, so that's a really big thing. And then these are kind of highlighting where those sinuses are. So when you get like a sinus infection, that's usually because of what we call that you have some type of infection in that cavity. The hyoid bone is another bone. This one does not actually articulate or connect to any other bone. It's very movable. And it's really important for the tongue and aiding in swallowing and speech. So that would be right here. What's interesting about the hyoid is for forensic cases, whenever they're examining an individual, they can usually tell if someone was actually strangled or anything like that by actually examining the hyoid bone, because it'll sometimes get like a crack in it if there was something that happened to the neck during a struggle. So the vertebral column is another portion of the axial skeleton. So there are 24 vertebral bones, and they are broken down into cervical. Okay, so that's 1 through 7. There are 12 thoracic. Okay, so T1 through T12. There are 5 lumbar, okay, L1 through L5. And then this area is really interesting. We actually have 9 bones, but they're completely fused together. This area would be what we call the sacrum, and then these last 4 fused vertebrae are what we call the coccyx. What's really interesting about the vertebral column is that it kind of changes as we grow. So initially when babies are first born, they actually have this really what we call like almost like a C shape, a C spine. And it isn't till later in development that we actually get an S shape. So one of the really early, when Dylan was getting older, one of the really interesting things was kind of how the spine develops, I thought. So one of the big kind of milestones, I suppose, is when a baby can start to actually lift up their head. When they can start to lift up their head, that's when they're developing this portion of that S shape of the spine. And then eventually, whenever the baby can actually get up and crawl, that's when they actually start to get that bottom curve of the spine. So like something like this. As we age, though, sometimes our spines don't quite stay in that S shape. That's the way that it should be, and that could be. And when that happens, someone could have something like scoliosis or kyphosis or lordosis, depending on where their spine is kind of not in alignment. The thorax is another portion of the axial skeleton. So you can see you have this nice bone right here. You have the sternum. The sternum is connected to ribs 1 through 7. These would be our true ribs. Okay, they're they're connected right up to the sternum. You have some false ribs. Okay, these are going to be the next couple, 8 through 12, and they are not perfectly connected to the sternum. There is kind of like a connection to each other, and there's definitely some cartilage here kind of providing some stability, but they don't attach to the sternum as well as what we would call a true rib. And then you have your little floating ribs down here that actually don't connect with any of these ribs. And then part of the bony thorax is the thoracic vertebrae, but they're also part of the vertebral column as well. Okay, but they're all kind of connected to each other. Okay, so next thing I just want to go through is the appendicular skeleton. So if we're looking at the appendicular skeleton, there are 126 bones. These are going to be your limbs, and then you have 2 different girdles, the pectoral and the pelvic girdle. So here is the back. These are the ones that are just kind of like bone colored. So the pectoral or shoulder girdle is going to be the clavicle and the scapula. Okay, so the clavicle, or what we call the collarbone, and the scapula or the shoulder blade. These bones are really important for your upper limb movement. Bones of the upper limb are going to be your humerus, radius, ulna, carpals, metacarpals, and phalanges. These are going to be composed of mostly long bones, so but the little carpals in the wrist are going to be some of those short bones. Looking closer at the hand, Here, the carpals, you do not need to memorize these individual names. You need to know that these are carpals, though. And then you can see here's the metacarpals. There are 5 of them. And then the phalanges. You would think that there would be 15 because we would have everything consistent between all the fingers, but you actually only have 14 because instead of having 3 like the 4 digits over here, your thumb actually only has 2. So the last thing I want to talk about is the pelvic girdle. The pelvic girdle is actually pretty interesting because it actually differs significantly between the sexes, and I'm going to talk about that in just a second. Two coxal bones come together to form the pelvic girdle, and the ilium, the ischium, and the pubis are like 3 different sections of each of those coccyx. So here, this area is the ilium, this area is the pubis, and this is the ischium. A lot of weight rests on the pelvis, so it's really, really important for kind of supporting the body. And in addition, it's really important for protecting several organs, like the reproductive organs, the bladder, and some of the intestines is in there as well. Let's look at a comparison between the sexes. I think this is quite fascinating. The major difference and the reason why there's a different shape, it has more to do with childbirth than anything else. Men do not have to pass a child through this pelvic opening, so their pelvis is kind of, I guess, less open, and there's not as much of the inlet isn't quite as large, and the ilia don't flare out very much. So let's just kind of go through a couple of things. First off, females is much larger. If you compare females and males, and by just looking at them, you can usually see that females typically have kind of a bigger waist than like a male proportionally to other places on their body. The female pelvis is also shallower. You can see like how this one is longer. Okay, this one's shallower, and those ilia flare out laterally. That's really important. That's going to help open up this inner inlet. Female also has a shorter sacrum, so this area right here is shorter than a male's, okay, making this opening much larger. And then the ischial spines, okay, so these little spines like right here on both sides are also going to be a little bit shorter and farther apart, making the opening larger as well. And then you can see that the pubic arches also has is a little bit more rounded and has a larger angle. This is also going to help with the opening. So this is actually really helpful and can be used to identify and look at skeletons and determine if you're looking at a male or a female. So bones of the lower limb, I think that's the last thing, yep, that we have to cover. Bones of the lower limb, we have our femur, the tibia, the fibula. Those are going to be your leg bones. And then here is the foot. You have the tarsals, okay, the bones that are going to be found in the ankles. The metatarsals, there are 5 of them. And then there are 14 phalanges, okay, just like with the hand. Though these bones are a little bit different in shape, structurally they have a lot of similarities in how they function. So those are the bones of the body. All the ones that I went through and mentioned are the ones that you're responsible for knowing. I do have a practice activity on Haiku that you can go through and practice memorizing these bones, as well as you can work on your coloring pages and use that to help you. Sorry, my dog keeps like sighing next to me. That's who's making all that noise. Well, I guess have a good day, guys, and bring any questions with you to class.